Last time we visited, we talked about the impact test, how that's utilized to determine red flags and set baselines for the players off the ice before they begin play. The SCAT, though, is what you utilize on the ice as a first gut reaction to what you could possibly assess. So what is SCAT?
So SCAT is the Sport Concussion Assessment Tool. It's now in its 5th edition. Doctors get together once a year or whatever and basically talk about it, change some things. It's now in its 5th edition. They went from the 3rd to the 5th. They skipped 4 for some reason. But basically it's what we use immediately post-injury in the training room, in the dressing room, to basically get a snapshot and have a documentation of where they're at cognitively. So it starts off with a series of symptoms scored 0 to 6. Just like when you took the impact, it started off with symptoms. It's the same thing. Our protocol here at the ECHL is basically if they have any symptoms, they're removed from play for further evaluation. So I have a little card that's laminated on the bench basically, and if a guy gets hit, I'll start asking him those symptoms. If he reports anything that red flags me, we pull him off and take a look. So it's different parts. So it's symptoms, and then there's like memory. So I give them a list of words, they give them right back to me, and then like months in reverse order, kind of a cognitive test to see how their concentration is, and then like digits. I'll give them a series of digits and have them give them to me backwards. So if I go 6, 1, 9, they go 9, 1, 6, and there's a series of tests like that, and then at the end we go back and say, what were those words that you answered at the start of this? So that tests their delayed recall, kind of like what you had to do when you sat down for the impact, right? So it gives you words, you take the rest of the test, and then, oh, by the way, what were those words? And it's just kind of a snapshot immediately post-injury where they're at, so we can have an objective look at it.
So it's essentially the impact test without the use of a computer, and it's utilized in person.
Parts of it, yes. So like we don't have the designs and stuff like that, and the speed component that the impact does with the X's and O's and counting backwards and stuff like that.
But it's still comprehensive enough that it does give you a snapshot as to what you're dealing with.
Yes and no. It's one tool that we have. There's a couple of other tests out there. There's the King Devic, which is gaining popularity. We don't use it here, and that's where you basically count numbers as fast as you can, and then you record how many errors they have. There's the VOMS, which is what Phil over at Promotion uses. We might start using that here. So the VOMS is basically it's a vestibular ocular motor screen. So they do convergence, saccadic movement, so back and forth, up and down, and how your eyes track. And that's another piece of the puzzle, right? So SCAT is just one little piece of this broader thing that we use to diagnose concussions.
You talked about their additions earlier and how they somehow skipped the 4th one, but nonetheless, any changes you can tell us about from the 3rd to the 5th edition that you use?
It's more just verbiage. So it starts off and it gives you literally in red on it, these are the red flags. If any of these signs or symptoms are exhibited, basically skip this, take them to the emergency room. And then it has some more like when you send the athlete home, this is what they should look for, and it's more kind of patient oriented in that regard at the end. But that's like the nuts and bolts of it are pretty much the same.
So let's put you in a scenario here. If you recall from the NHL playoffs, Sidney Crosby took that huge hit to the back of his head, and they started to determine down the line that he was concussed for a brief moment and that he suffered some head trauma. So let's put you in the shoes of Pittsburgh's trainer. You get out there. At what point do you realize I need to start using SCAT?
So it's basically we use it in that situation. That's what it's there for. So first you would make sure that they don't have a cervical injury and run through your ABCs, as we call it, so airway, breathing, circulation, stuff like that. Make sure there's not a more serious injury there. If there's something more serious, then you divert and you go the EMS route. If it's not, then that's when SCAT comes in, and basically They're removed from play. They're sent to a quiet area. Here would be my office or the training room as long as nobody else is in here. And we do a more thorough evaluation with the SCAT.
What triggers the use of SCAT when you get out there and you see the player?
So if they exhibit any of the signs or symptoms, so headache, dizzy, nausea, if they're just not themselves, then it's something that basically we'll pull them off, we'll take a look, we'll run them through it, and then generally Dr. Dietrich and I will have a discussion, and maybe they're dehydrated. There's so many things that can cause a headache. They get hit in the head. Is the headache on the side of the head where they got hit, or is it on the other side? Because a concussion is basically your brain sloshing around in your skull. So if you get hit on the left, but your headache's on the right, that's because your brain shifted over and hit on that side. If they have a headache where they got hit, then that's when it becomes that blurred line as to, is this a headache from a hit, or is it a headache from a concussion? And then that's where the SCAT comes in. If it's a headache from the hit, they should test out normal. They should be able to remember the words, do the months in reverse order, do the digits. Their balance should be good. If it's a concussive injury, then some of that might be scored less. They might have issues with it because of the cognitive issues from the concussion.
Now, obviously, in part 3, we're going to dovetail into concussion protocol and talk with Dr. Dietrich, the medical director. At what point in the protocol, does SCAT lead into the protocol, or is SCAT part of the protocol?
SCAT's part of it. So with the first step, it's like the initial recognition and treatment. And so that initial recognition is me on the ice. Then you go into the SCAT, and that's kind of if they test out normal and they look good to me and Dr. Dietrich, then we have a discussion, and we may say, what, hey, you're good to go, but just I'll check in with them on the bench periodically and during intermissions and post game. If the SCAT looks abnormal, then they're removed, and that protocol more or less starts/continues.
That'll wrap up part 2 of our 4-part series here on Rush TV All Access regarding concussions. When we come back for part 3, we'll sit down with the medical director of the Rapid City Rush, Dr. Christopher Dietrich, and he'll give us his thoughts on how concussions and concussion treatment have evolved in his time as a practicing doctor and what goes into writing the concussion protocol. Until next time, this is Mark Binetti alongside you for Rush TV All Access.